One of the things we're seeing now, Rex, as we're moving forward, is a really expanding field, and that's the area of working with the aged. What we're finding in our practice a lot is an increasing frequency of family members coming in with a loved one who may be suffering from some form of a dementia.
Donald, I want to ask you a question. Because a lot of times people will ask me, I'm doing a workshop or I'm doing an assessment, and somebody says, "Can I talk to you, Doc, just for 1 minute?"
I have this friend.
Yeah, just 1 minute. I have someone at home, and they keep forgetting things, and they're becoming argumentative. Do they have dementia? Or everybody knows the term Alzheimer. And every once in a while somebody will say, "What's Alzheimer's and Lewy body dementia?" But one of the things that I'd maybe like to take a couple of minutes and talk about is truly what is the difference between dementia and Alzheimer's. I think a lot of people will commonly use Alzheimer's and kind of block that out and think, wow, if somebody's having a problem, it's Alzheimer's, and they use that as a general term for many different types of dementia. So talk to me a little bit about what's dementia and how does it differentiate itself from Alzheimer's?
Yeah, I'm glad to hear that's happening in your practice too, because they frequently will have people come in and say, well, geez, I'm glad they only have dementia and they don't have Alzheimer's. Dementia is more of the generic term, Rex, that describes any type of an illness or dysfunction that can lead to a decline or a degradation of someone's thinking and cognitive abilities. If you think of facial tissue, for example, as the generic, then you have puffs, Kleenex, and so forth as subvariants of that. We have dementia, and underneath that we have a half dozen or better types of dementia, the most common of which is senile dementia of the Alzheimer's type. So it becomes a bit of a semantic thing, but dementia is the generic. Alzheimer's is more of a specific type and the most common, but we have other ones as well. Pick's dementia, frontotemporal dementia, vascular dementia caused by multiple strokes, Lewy body, Parkinsonian dementia, and so forth. And
some dementias can be brought on through medication.
That's true, although in many of those cases those things are reversible, which is why you really want to get a hold of a good evaluation so that you know what to do and what treatments are possible.
Let's take a couple of minutes and explain to people what it is that you do in an assessment for dementia. So we could separate. There are a lot of people say, oh my God, I forgot where my keys are. I must be having Alzheimer's, or as I hear frequently, I'm having a senior moment. What is it that psychologists do to really identify that someone has, if you will, a diminished capacity, I might refer to it as, or a dementia?
One of the important things that psychologists brings to the table, Rex, is the ability to assess and compare an individual in contrast to their same age peer group. We all forget, as you well know, day in and day out, little incidental things. Where did I put the keys? Who was that person's name? Did we just talk about this? And a certain amount of that is frankly just benign forgetfulness that does occur with aging. The importance comes into play when you're able to demonstrate through administration of tests that the pattern of the person's thinking or the extent of the memory as well as other reasoning deficits is actually different from that of the normal aging. So we usually do an extensive interview not only with the individual but also with family members, because a lot of times the family is really the one that sees this, and the person comes into the office and says, well, I don't know why I'm here, they think I have a problem. We ask a lot of the background, but then also functional questions. Is the family afraid to drive with you anymore? Will they not let the grandchildren in the car with you? Have you had any late fees, put the wrong envelope or wrong check in the wrong envelope to the wrong place? Have you burnt food? Have you found food in the refrigerator that belongs in the cupboard and fruit in the cupboard that belongs in the refrigerator? Once the assessment is done, that's really when the work starts, however, because then it's working with the patient and the family as far as managing how this all unfolds and the impact that it has on both of them.
Don, I'd like to ask some questions about the drugs, and I'm a bit of a skeptic when it comes to some of these drugs because I don't know truly about the efficacy of some of these. But what are your thoughts on some of the Alzheimer's or dementia medications that are out there? How do you see them working within your practice?
Well, right now, Rex, there are five that are actually on the market. One which is not used very much. So we have the big 3+1, Aricept, donepezil, Exelon, and Razidine, and then a fourth medication called Namenda. The primary depends on who you listen to. There is some debate as far as their overall efficacy. However, many folks do find them to be very useful in terms of slowing down the eventual progression of any of the forms of dementia. But what I find from a psychological standpoint is that no matter what the form of the dementia is, no matter whether they're on medicines or not, you're still left with the social and psychological and emotional impact that the progression of the disease, no matter how fast or how slow, brings on the family. And so you need to be able to prepare the family through education, through strategies about what to do. When is the time that mom and dad shouldn't be driving anymore? When does the time come that they should not be living unsupervised? How do you make those decisions? How do you handle those things? And those really are where the psychologist really comes into their own as far as helping the family.
So it's working with the patient and helping them to understand the progression of the disease that they have.
Sure.
But it almost seems more important to that is the ability to work with the family and help them to come together and to maintain the sense of family unity and understand the progression of the disease and what that disease may be able to do or could do within the family.
You know, families are often really conflicted because they want their parents to be safe, yet and what I say to them is, you know, safety is always number one, and so you want to try and respect the dignity and the ability to remain autonomous and living on their own as long as safety is protected. And then as time moves by, then other decisions have to be made. But many folks want to jump way too fast. You know, we have a diagnosis of an early dementia, and the family says, well, let's go pick a nursing home. Well, that's moving too fast, perhaps. And part of our help then is helping the family to understand the progression as it applies to that person and what kind of things are important.
We have an aging population, and the traditionalists now are moving well ahead, and we see a aging population achieving 70, 80, and 90 years old with a great deal of frequency. Some suggestions, some final thoughts on dementia if somebody watching this might be able to say, here's the one or two things that I should do to really find out about if my parents or grandparents have dementia.
I think what I would say to that, Rex, is that there's certainly no harm in getting an evaluation done. The best outcome is that we have no finding of any kind of a decline. But then what you do have as an asset is that you have a baseline against which, if something would change in years to come, you can go back and reference and be able to say, well, in 2011 there wasn't much of anything going on, and here's the data in 2014. Wow, look at the difference. So I think even if there's a slight question, I think getting a baseline is really not a bad idea.
That sounds like good advice for people. And I think it would also create a calming effect to at least understand mentally where your parents or grandparents are. Donald, thank you for sharing your thoughts
My pleasure, Rex, as always.
Ideas today. Good.
Yeah.